All right, welcome back, everybody. This is going to be a little bit different than what we've done the last 2 months. I want this to be an opportunity for us to really get some interactive practice in terms of our communication. Uh, Chiropractic is incredible, but you don't get a chance to deliver chiropractic if you can't communicate effectively with another person. And I think that's incredibly important, especially for some of the chiropractors that are relatively new into practice. You've probably looked around and you'd be like, wow, that chiropractor is really busy, but they're not that good of a chiropractor. Wow, that chiropractor is a phenomenal chiropractor, the best adjuster I've ever seen, and why can't they build a practice? Communication is the artistic expression of how we convey chiropractic to one another outside of our hands, right? If the actual technique is the artistic expression, hands-on, our communication is the artistic expression of the science and philosophy of chiropractic through, words, through, examples, and, all sorts of other opportunities. And we need to practice that. That's also a skill that takes practice to develop and become effective at. One of the things that I've noticed through teaching for the ICPA and even doing this in the last couple of weeks or last couple of months is I've heard from people who write back to me and say, I love the way that you communicated this, right? Or I love the way that you make this so simple. And honestly, that didn't start right overnight. I mean, when I first opened up, even when I was first, learning really chiropractic when I was in school, I used to make every mistake you can possibly imagine at how you communicate chiropractic to other people. It was kind of amazing how many people I turned off to chiropractic in my effort to try to share how excited I was. And there was a story, I can't remember where I heard it from, but they talked about, imagine, for instance, and, whether you're religious or not, just pretend for a moment that all of a sudden you got sucked up to heaven and you met face to face with God, and God started talking to you about, the existence of the world and the true purpose of humanity and all of these, deep secrets, and then sent you back to earth. And you were so just lit up and excited, and you couldn't wait to tell everybody. And you ran up to the first person who's in front of you and you started grabbing them by the shoulders and you shake them and you said, guess what I just heard? I just went up and I met God and this is blah, 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 blah. They're going to think you're absolutely nuts, right? And then you go to the next person and the same thing's going to happen. And the next person, the same thing's going to happen. And honestly, that's kind of how new young chiropractors sound, right? I found that we get so excited and so passionate about this amazing thing we call chiropractic that we completely forget all sort of etiquette and tact and effectiveness in terms of how we communicate what it is that we do. So I think that's something that we really need work on. How many, and you can, turn your camera on and wave if you're so inclined, but for the 3 people that I can see, how many of you have, through your communication, turned somebody off to chiropractic at one point? Yeah? I mean, yeah. I mean, listen, I have family members who I love dearly, who love me dearly. We have a great relationship. And when it came time for their pregnancies, when it came time for raising their children, they never once sought my advice, because in the beginning of my excitement, I had created so much like negative energy that I was just repelling family members at the time. And I think it's important that we recognize that. And I wish I had been warned by somebody that that was possible, because I feel like there'd be a lot more people who would be open to experiencing chiropractic if I hadn't done so much wrong in those first few years. So I've got some topics that I want to cover, but before we do that, I want to hear from you. What are some things that you find you struggle with in terms of the communication of chiropractic? I'm going to write them down so that way I can make sure that I come back to it a little bit later. So who's got some stuff that you say, you know what, I am in practice and this has been what's going on. and I am just really terrible at this part of communicating, or, hey, I got this question last week and I have absolutely no idea how to answer it. Who's got something?
I'll go first.
Okay.
Hey, Dr. Ian, how are you? Hi, everybody.
Good.
Let's see here. I'm first year in practice. I am kind of somewhere in between, like if I start talking about chiropractic, I want to give them the last 4 years of my schooling, or I won't even mention anything about chiropractic on their first and second visit, and then I'll just slowly start dripping in information. So those are the two kind of opposites of where I am right now. But since I took Dr. Amy Spolstra focus, I am really focusing on just talking about the brain development and how the brain early on in utero as well as early in their life can be impacted by stress. And so how do we nurture that proper brain development in order to get us the whole brain processing? So once I kind of understood that, it's much easier for me to talk about the consequence of vertebral subluxation. And so that's really talk about.
Cool. So in the beginning, you wanted to share everything, and then you kind of forgot what to share, and then you found like a happy medium. I'm sure everybody in practice can resonate with that. I mean, my consult has changed, 30, 40 times in the last 9 years as I decide, what to share and what not to share. Who else has a challenge or a question or something that came up in the last, couple weeks, couple years, or areas that you feel like you've got, but you aren't really sure that you're super confident in it?
Hey, everyone. Hi, Dr. Ian. Hey. So something that's come up, open to May, something that's come up a lot is they've been to other chiropractors and they're crack addicts, and they're already suspicious for some reason. Like, I think we do an okay job, but when we start telling them, we're like, listen, it's not all about the noise, and we explain to them what a subluxation is and what we are doing, and we try really hard not to like crap on the other chiros, but I'm like, listen, like my goal is not automatically like you hear your whole entire back go the whole thing. Like sometimes you don't hear noise. So that has been a question a lot, and I'm still looking for a way to answer it.
Yeah. That's a really good point. I think sometimes when we have people who have been to our offices, in some ways, the people who are brand new to chiropractic are some of the easiest people to communicate with because they don't have any frame of reference. And sometimes when people have been to other chiropractors, it makes it more challenging because you've got a lot of people that you have to kind of deal with, layers upon layers of messaging and stories and things that people think that they know. And sometimes it's really hard to combat with, what people think that they already know. So thank you for that. Yeah. Who else has something?
I had, go ahead. Okay. So yesterday I had a new patient that was referred to me. I called her and she is being induced on Saturday. And she said that she can't come in because she's dealing with having to be tested for COVID before going into her, being induced. So she didn't want to come in because she has to do all these things to be medically ready for this birth.
Yeah, it's kind of crazy what people are going through right now in terms of, the hospital systems and giving birth. And I found a lot of people are calling up saying, well, I only have, 1 week until I'm being forced to be induced. And so is this even worth it? Or, I've got so much going on with so many other appointments, I just can't make it today. Those sorts of topics come up all the time, but especially with what's happening now, it's even more so. So thank you for sharing. Gabrielle, did you have something also?
Yes, I have two things. So obviously I'm in clinic at Parker, and the first thing is I had a baby come in, like a 2-month-old, and it was hard to explain why the baby had to come in when the mom was like, oh, my baby's perfect, like she's feeding fine, everything's good, without showing her any type of nervous system scanning, HRV, anything like that. And then my second question, and this might be a stupid question, but I'm having a hard time explaining, I guess, more outside of musculoskeletal, more nervous system, and adjusting on tone, specifically what tone is.
Yeah. That's a really great point. And it's one of the analogies that I forgot to include. But I'm definitely going to include that analogy about tone because I think it's important. And whether you have a segmental technique like Gonstead, or you have a regional technique like Thompson, or you have a tonal technique like upper cervical, or a variety of other techniques that are tonal in nature. When you apply a force to the spine, you are affecting all of it. Right? You're affecting a segment, you're affecting a segment, you're affecting the regional, and you're affecting the tone, whether you consciously, are intending to or not. And so it's important that you have analogies and you have ways to communicate some of these more, higher level topics. Otherwise, you end up in a situation where what you do is important and it works and it's relevant, but you can't necessarily, for lack of a better term, dumb it down to the way that somebody else can understand it. So yeah, that's a really good question. And that's definitely one of the analogies, one of my favorite analogies actually, that I'm going to reference in a little bit. Yeah. So who else has something that has been a challenge recently, or you feel?
Hey, Dr. Ian.
Hey, how are you?
It's good. So I've had a difficult time. We've had a couple overprotective moms that watch everything that you do. Yeah. So I was wondering how to properly communicate to those moms when they're questioning, oh, a male doc is going to be touching my teenage daughter around her pelvis.
We explain the adjustments and they are very uncomfortable at the sacrotuberous, and they don't directly request me, but they're like, Dr. Chris won't be seeing her, right? I'm like, okay, okay. And we don't know how to handle that.
It's it's a weird thing. I mean, listen, I just had a patient last week say to me, Dr. Ian, if you were born now, if you were part of this younger generation right now, would you consider yourself non-binary? I was just like, no, like I mean, I consider myself to be a man, but the context, or the concept of like a male, a straight cisgender, male doctor having a passion for pregnancy and kids and working with that population, in some ways it almost kind of seems a little weird. And you have to realize that a lot of the moms that are coming to you, they might have very protective, very controlling partners, but they also might have partners that are very aloof and controlling without being engaged in the process. That's something that I've noticed that's been like really frustrating, is when you really want, you can help, and one partner says no, and the other partner really wants to, but also wants to respect the partner's decision. And it becomes this kind of difficult balance. So that's a really good point. We'll talk about that also. Yeah. Any last topics that have just come up? I mean, obviously I've got like some plenty of things to talk about, but I just wanted to see if there's anything that I hadn't already included.
So I have something.
Go ahead, Megan.
I have something that just came up. So I don't like doing anything on the fly. I'm the kind of person that, like, early on wrote out all of my systems, wrote out like everything I'm going to say day one, all the reported finding questions that people can have. I just like knowing what I'm going to say. I don't like to ever be caught off guard. But I had a mom. So I've been in practice for 6 years, and this is the first time that I've seen this, and then had a mom ask about it. A 12-month-old, they started probably when he was 11 months, mom and baby started, and he has a funny crawl, like drags one leg, it's kind of like the sitting crawl, like pulls himself.
Sure.
So we gave her some exercises to do, and I've been adjusting him, and he isn't dragging his leg now, he's like lifting it. And she said, I know how important crawling is for his neurology, and we're doing all these exercises, he's coming in, he's getting adjusted. He's starting to pull up and he looks like he's gonna start walking. What's the detriment if he never gets the full crawl before he starts walking? And I was like, Huh. That's, that's a great question. And I don't feel like I've been caught off guard like that in a while.
It's fun to still be like surprised. I mean, you know, it's 6 years in practice. It feels like forever, but it's kind of an infancy in terms of practice. But it's fun to get surprised in those situations where you see people, you know, come up with things that you've never heard before. You know, that actually, it's a really, you know, important concept in this conversation about communicating chiropractic is, you know, we want to have all of our answers ready, right? We want to be able to know exactly what we're going to do, you know, when somebody asks a challenging question. And the reality is that's not always possible. And it's not always, you know, sometimes the question isn't posed in the form that is easy to use a script, right? And so you need to be able to understand the information in a way that has you capable of communicating in different ways based on the situation. This is actually one of the reasons why I'm not a big fan of scripts, because I think scripts sometimes keep you locked in this pattern of communication that may not allow you to adapt as freely as you may need to in a clinical setting. When you have outlines, when you have kind of, these are the points that I need to hit, it allows you to custom tailor it to the person that you're communicating with. You know, and so that way you know where you're going, but you can create the analogy or you can use an example that just pops up as a result of your natural understanding. And this is where, if you remember from the first session when we talked about the philosophy, science, and art of perinatal chiropractic, I explained that you need to have a firm understanding of the philosophy, the science, and the art. Because when you have that, you can ask any question, and through that philosophy, you know, that foundation, and then understanding the science and the art around it, you can come up with an answer, even if it's just right there on the spot. And so I've totally been there, Megan, where you get like kind of stuck in, oh, I usually, you know, I have like a regimen, and then you're kind of stuck in the situation and you're like, you know, kind of tongue-tied. First off, I'll just tell you, it's totally okay to say, you know, that's a great question. Let me write something out for you so that I can be really clear, and I'll send it to you tonight. You know, I think it's important that you not feel, you know, that you have to have all the answers for people at all the time, you know, all the time. But the other thing to keep in mind, just for your point, is this isn't necessarily biochemistry. And what I mean by that is, in biochemistry, or at least I should say, you know, chemistry, you take, you know, one substance and you change one variable in the equation and see how it changes the outcome. That doesn't work in a human system. You know, our bodies are, you know, incredibly complex and resilient and self-organizing, and very often you can apply an adjustment in one person and it doesn't you know, has a completely different impact on their body than it does on another person. You know, in the same way that your lifestyle doesn't necessarily show up the exact same way. I mean, we all know people who are 100 years old and eat nothing but bacon, coffee, and cigarettes. And we also know people who have incredibly healthy lifestyles and who get sick and, you know, die at an early age. You can't necessarily know exactly how things are going to change. So when you talk about those developmental milestones, even when you talk about chiropractic to a prospective patient, you kind of have to be willing to just say, we don't know, right? Say, listen, this is an important step in the process of their nervous system to develop. We don't know, because there are plenty of people out there who skip the crawling stage altogether and don't seem to have any deficits in their, you know, development older. That being said, I would probably say that those are more the outliers than the norm in that situation. But you have to be okay saying, listen, it may not have any perceivable effect. And it could be, you know, a big difference in terms of their coordination and, you know, even their, you know, emotional development. I mean, you can kind of, I mean, the nervous system is so complex. You can show them how it's all connected, but you also at the same time have to make it reasonable so that you're not creating like this fear. And I'm really big on that, is you want to communicate possibilities, but you don't want to necessarily use fear as a manipulation tactic. because I know you would never do that either. So anyway, you know, that's just something to keep in mind, but we'll talk about like how to navigate those conversations on the fly. Cool. Carla, you had something, and I think, and then we'll get started. Go ahead.
Hi, everyone. I'm in student clinic, so I'm still a student. But just really quickly, this has come up multiple times. People always ask, like, why is the subluxation or somatic dysfunction in the same spot every time they come in? And I've explained it, but I've had a little trouble, so I'd love an expert opinion.
Okay, yeah, I love that question. And I've got a list of a bunch of stuff that I want to go through. If I don't happen to answer that question, please let me know and we'll kind of, come back to it. All right, so first off, one of the things that I want to kind of clue you in on, in case you weren't aware, is that the things that chiropractors like in terms of our communication are not necessarily in line with what the public hears well, right? Chiropractors have this amazing capacity to say things in a way that gets other chiropractors excited, but sometimes confuses the public. I'll give you a great example. Above, down, inside out, right? If you walk up to a person and say, all healing happens from above, down, inside out, it doesn't happen any other way. The person's just going to kind of be like, well, I mean, what the hell does that mean? Right? Because it sounds weird. If I say, I adjust the bone, God does the healing. Or, you can change it to, I adjust the bone and Nate does the healing, or whatever it is. That gets chiropractors excited, right? That's the spizzerinctum, right? In case, for those philosophy, nerds, the spizzerinctum that gets chiropractors excited, but it doesn't necessarily do much for our overall, public image. We need to make sure that we communicate and tailor our message in a way that the public will hear it, which means we need to speak into the things that matter to them. This is where I am completely against these chiropractors who talk about, well, I never talk about symptoms in my practice. And I understand the philosophical, concept of, I don't want the symptoms to cloud my judgment as to where that subluxation is so that I can make the correction wherever it needs to be. But we also have to realize that in many states, not only are we portal of entry, we're also considered sometimes primary care providers. We have an obligation to our patients to be able to support them. So, talking about symptoms is not necessarily even a diagnosis thing, as much as it is just a tool that you can use in communicating. And so it's totally okay to talk about symptoms, but talk about symptoms within the concept or within the context of chiropractic and how subluxation correction will, impact this person's quality of life. Okay. You also have to realize that many people are coming to you. They want to hear you talk about the things that are important to them. So I'll give you a for instance. I had a pregnant patient came in earlier today, and she's 35 weeks pregnant, and she's planning a vaginal birth, and she's got some right SI joint pain. I spent my entire consult talking about fetal position and the biomechanics of birth and how her pelvis is going to move and how this is going to help baby get into the best position and how all of these things. And I was just like, I was feeling it, right? Like I felt really good about my consult. And then all of a sudden, I kind of get through everything and I said, do you have any questions or concerns? And she goes, well, yeah, can this do anything for my back pain? And I just realized I was so excited about the way I was communicating subluxation and pregnancy and birth that I completely missed the point of why she was even there. If I would have used that to emphasize the role of subluxation in her quality of life and function and tied her symptoms into how the subluxation is going to affect other areas of her pregnancy and birth and her healing postpartum, that would have been really powerful. But instead, I just kind of left it. And that reminds me of a time where I was doing a presentation at an OB's office. and the OB's office, it was 14 OBs, and the talk was going great, and I was really just in the, in the zone. And all of a sudden, one of the OBs raised her hand and says, "Is there anything you can do for expectant moms who are having a cesarean?" And I just realized in that moment, man, I was talking so much about like natural birth or vaginal birth that I completely forgot that this is a practice that has a 50% cesarean rate. And, that, yeah, of course, chiropractic can help these parents. So make sure that you create that distinction between what matters to you or what you're passionate about and who you're talking to and what matters to the audience. In that situation, Megan, this is where it comes into, if you have a script that's set up in a certain way and you are answering in a certain way, it sometimes can create like a trap where you feel locked into communicating in a certain way, and it's almost like you're subluxated in your communication process, right? Where you're not as adaptable to the situation. And so it's really important that we pay attention to obviously what matters to them. Like, how are you going to create value for this person in front of them? If you've attended my ICPA class, you know that one of my favorite equations is value equals, or I should say, action only takes place when value exceeds the circumstances, right? And what I mean by that is people don't take action on anything if they don't see the value, and that value is higher than the circumstances of doing it. So like a new patient, if their main circumstances are time and money, let alone fear or, COVID or, any other kind of anxiety, thing that's getting in the way, if you don't communicate into their values to have them see the value of taking action, then they never will. The circumstances are too easily, will too easily get in the way of it. So make sure that you're listening first, right? You need to listen to what their concerns are. Otherwise, it's going to really make it difficult for you to communicate that value to them. A lot of times when you're talking to people, they'll mention keywords, right? Like if you're listening, intently, you'll be able to hear them talk about certain things that you can kind of buzz in on and say, that's something that I can tell is important to them. Sometimes you'll get situations where you're talking in a consult, and all of a sudden a mom will mention the fact that, oh yeah, it really hurts her when she tries to get on the floor and play with her kids. And that's the type of thing that could just be like an easy, like, okay, activities of daily living, right? Get down and play with kids. But if you're listening to that, it's not that saying like, oh, I can't do it. It's that when I want to get down and play with my kids, I'm not able to do so. That is something that will pull at the heartstrings of that parent. And if you can key in on those certain words, it allows you to then focus your energy and your communication on that, which becomes much more impactful for them. And I think that's really important. So definitely listen and be adaptable in the way that you do things. I already talked about understanding your material. The other thing is, Alexandra, you mentioned that when you first started, you wanted to share like all 4 years, the last 4 years of your education. The truth is you need to be able to pick and choose what's relevant. If I wanted to talk with a medical doctor about chiropractic and I started unloading all of the, spinal biomechanics and neurology, you're going to get that glazed over look, right? And I guarantee you, all of you have been in a consult or a report of findings and you're talking to a prospective patient, and all of a sudden you realize, wow, they're not listening anymore and I have no idea what I'm talking about. Right? That happens to all of us, and that's okay. Just be really cognizant of what it is that you think is most important to convey in a way that will be effective, okay? In that case, avoid sharing too much. Chiropractors love to go on and on and on and on and on and impress people with how much they know, especially in an effort to try to seem intelligent. And the problem with that is, again, you're going to blow past the attention span. You have to realize we're in the world of 140 characters. We're in the world of TikTok and Vine, which, by the way, Vine was way better than TikTok. But we're in this like momentary attention span that you need to be able to communicate concisely and not share too much. Otherwise, people aren't going to be able to hear you. And the one thing I also say is be outwardly focused. If you're going to talk to people, whether it's on social media or out in real life, don't make it about you, right? And I know this is like hard for new chiropractors who are trying to establish themselves and create their practice, is you want to communicate and try to say, hey, come talk about why our practice is so amazing, or, come see us. And it becomes more about you than it is about them. And the challenge with that is when you make it about you, it makes people less, it becomes less impactful for them. It makes them less drawn in. I use this analogy when I teach for the ICPA, is that millennials as a population are very altruistic, right? We want, we're more than happy to give of ourselves if we think it's going to help other people. So when you talk to a patient about how amazing their child has responded with chiropractic, if you're talking to them about, hey, we'd love to share their story so more patients can find our office, that's different than, hey, there are a lot of other kids out there that are struggling the same way your child did. If we can share his story, it'll help parents around the world find chiropractic as a possibility that they otherwise wouldn't have. Is it okay if we share a photo of your child and share their story on our social media? That calls them to a much higher purpose, right? If you're talking to an OB, for instance, you want to make sure that you're talking about not, hey, I want you to send your patients to me. It becomes, I want us to work together so that I can refer patients to you and that we can share patients and help our community be healthier, right? Make it outwardly focused. People are going to be much more receptive to that than they will if it's more, kind of internally focused. Now, one of the things that I want to kind of touch on is the importance of story. I want to share something. Let me see if I can screen share this real quick. Okay, so this is a project from a friend of mine. In case any of you remember Dr. Mary Flannery, she was the Dean of Enrollment at Palmer and then Life and then Life West. And she was a really big fan of how story helps connect people. If I just recite a bunch of facts to you, it's not going to land, certainly not create an imprint on who you are, as if I told you a story that embodied those facts. Story is incredibly valuable, especially in how we communicate chiropractic. And, you hear from people, all you have to do is tell the story. All you have to do is tell the story. But as a profession, we're pretty terrible at telling the story. We make it about how great we are instead of how, the patient responded. We make it about, what we've created in our office, right? Like chiropractic as a storytelling profession is very egocentric. We often make it very much about ourselves. And I'll tell you why I can tell you that with confidence is because the single most consistent compliment I get about any, presentation that I give is that I share the stories of my failures, is that I share how I've screwed up. I share the people that I've turned away by saying the wrong thing. I share the times that I'm not so awesome. And in doing so, it allows people to connect and resonate, and they hear that and they appreciate it so much more. So this is a really good resource, especially for young chiropractors. And she's got a couple different programs. One of them is, she's got some classes, for instance, on like how to do public speaking or how to write stories, so check it out. I'll send out this link in the resource, but it is an awesome opportunity for those of you, especially if you're not really confident in public speaking or you're not really a good writer and you want to practice those things. These are great resources, so just something to, to consider. All right. Let me see. How do I get back? Stop share. Cool. So here's one of the things that I want to start off first is I want to kind of go through the kind of new patient process. And while I go through this, I want you to stop me if there's an area where you feel like you struggle with, right? So if I talk about, you're talking with a new patient who's pregnant and you feel like that's an area that you struggle with, I want you to bring up your, interrupt me and bring up the challenges, because I want this to be interactive. I don't want this to just be, me, talking for the next hour, however long. So I'm going to share, I'm going to screen share this, and then we'll kind of go through some stuff. Okay. So when you're talking with new patients, first of all, I think this is really important, not only for you, but for your staff to learn how to communicate chiropractic in a way that is always beneficial to your patient. If you are scheduling in a certain way, communicate your scheduling process in a way that is of benefit. For instance, in our office, we do a complimentary consultation for any prospective patient. And the way we set it up is we reserve an hour of time. The first 10-15 minutes is the patient filling out paperwork in our office. The second 15 minutes is the consult, where we're having a conversation. And if they choose to continue, we have the next 30 minutes for the evaluation and scans, x-rays, etc. right? And so it's all kind of set up. That being said, when a patient calls up and says, hey, I have some questions, we say, great, we have a complimentary consultation available. Now, we don't just leave it at that, because if you called up a place and said, oh, I have some questions about getting chiropractic for my family, and they said, great, come in for an appointment and we'll talk. You don't know what you're getting yourself into. That doesn't sound appealing. It sounds like you're going to get sold into like a timeshare or something. What you need to do is communicate the value of why that matters to them. And this is where in our office, I say something along the lines of, we schedule a complimentary consultation. This is an opportunity for you and the doctor to meet each other and discuss your goals, your health history, and everything about our care, so you can decide if our office is the right fit for you. Now, you see, that's very different than just saying we have a complimentary consultation. It's communicating in a way that has them see value through the communication, right? There's nothing inferred. I'm specifically saying, explicitly communicating why this is of value to them. And the truth is, gosh, 95% of people who call up inquiring end up scheduling a consult. And in the way that we do the consults, 90% of those people continue with care. And so, creating that value in the way you communicate it is a big difference, because, hey, yeah, great, we have a complimentary consultation. Would you like to schedule an appointment? Versus, we have an opportunity for you to meet with the doctor to discuss your goals, for them to learn more about your history, share more information about how our office works, including finances, so you can figure out if our office is the right fit for you. What works better for you, Monday or Wednesday? It's communicating the value in there that allows them to overcome the circumstances of the inconvenience and the time and all those other things to actually take action and schedule the visit, okay? So I think that's a big important thing to remember, and you can apply that to anything, right? Just ask yourself, if you're not getting the intended action, where are you sacrificing, or where are you missing the value conveyed about that particular action? Now, when I say connecting the dots here, I literally mean connecting the dots between what's important to them. By the way, I just realized, in case my internet drops like it did the first time, just hang tight and I'll be right back, okay? So when I say connecting the dots, if you're talking with a patient, like I alluded to earlier, the pregnant patient with the low back pain that I was talking so much about her pregnancy or about the birth process, I didn't connect the dots about how subluxation would create the pain and how the pain is an indication of the subluxation, right? I didn't make that connection. So even though everything that I was going to say was there, I didn't explicitly make that connection for her. And as a result, it wasn't as impactful. And she left with a question of, well, is this even for me? So when you're doing things in your office, all of this is about avoiding those questions later on, right? The last thing you want is for a patient to come back and goes, oh, by the way, what was that you did last time? So when you connect the dots as you're going through this, it helps them feel more confident and comfortable with everything so that it saves you work on the back end. You won't be bombarded with stuff later on. So if you're doing scans on somebody and I'm doing a thermal scan and I'm running the scanner up the back, I want to connect the dots of why this is relevant, not only to their nervous system, but why this is relevant to them and their reason for coming into the office. This measures the temperature going up your spine. When your nervous system is working properly, you should have equal temperature on both sides. When one side is warmer than the other, it tells us that your nervous system is not regulating your blood vessels as well as it should, and that's creating the temperature disparity. Your temperature is also controlled by the nerves that control your temperature also control the organs and glands through the rest of your body. So we can use this as a way of measuring everything else. Hey, look at your scan. You see the temperature areas here that are really more active than they should be? That connects with the X, Y, or Z symptom that we just talked about, or that connects with this bodily process that you're concerned about. And so as you're going through your exam, if you're doing posture, take a picture and quickly show them, wow, look how far forward your head is compared to your shoulders. That's going to put a lot of strain on your neck, causing headaches and tension. Connect the dots as you're going through this, and what you're going to find is it's going to be, it's going to really land for them and it'll be much more impactful. When we talk about the first adjustment, let's be real. Chiropractic is weird. If I had a new patient on the table and I didn't explain anything to them, and I start looking at their feet, and then I go and I, toggle their atlas, and then I go back and I look at their feet and say, wow, that was amazing. All right, flip over on your belly. Like, what the hell was that? Right? You have to think to yourself, if you were somebody who knew nothing about chiropractic, absolutely nothing, would you understand what you were doing right now? Most of the time that's no, because chiropractic is weird, right? And I do a relatively easy to explain technique. I mean, imagine if you're, I remember the first time I walked into a network office and, all of a sudden I see the chiropractor kind of, doing this and the patients start like, undulating. I mean, chiropractic is bizarre. It's incredible and it's amazing, and it's why I love learning about it. But if you're not explaining to people clearly in a way that allows them to understand it, that's really tough. So was it Gabrielle, was it you who asked about tone?
Yes.
Okay. So my favorite analogy to talk about tone and why if we adjust your atlas, it's going to affect the balance in your legs as well as everything else in your body. I use the example of like a guitar. Now, sometimes I'll ask them if they are, if they play an instrument or if they've ever seen somebody play the guitar. One of the first things that a guitarist does is they pick up the instrument and they start to tune it. They understand that the tension in the string determines the vibration at which it, or the frequency at which it vibrates, which in turn determines the sound of the instrument. And if that knob is turned a little bit one way or the other, it changes the tension, the tone of that string. And as a result, it doesn't allow the instrument to be performed or to be played as well as it could. Doesn't mean that it has to sound bad. Doesn't mean that the guitar won't work, but it won't be up to its potential as an instrument. In the same way, when your spine shifts in these different areas, it pulls and distorts and changes the tone of the spinal cord, in which case it affects the way that the entire body as a whole is able to work. What we're doing as chiropractors is we're going to find the areas that are out of tune and use a gentle adjustment to help normalize that tone and normalize that tension in the nervous system so that your body can reach its full potential. Does that make sense? Gabrielle? Yeah?
Yes, sorry.
Okay, cool. Because, you know, what you want to do is you want to try to take complex topics. And by the way, analogies are my favorite thing to do. I'm going to talk about, you know, analogies and some tools that you can use in the office, but analogies are great because it allows you the opportunity to, connect the dots for people in a way that they understand. I mean, if you're talking to a musician and all of a sudden you bring up an analogy about guitar, or you're talking to an electrician and you bring up an analogy of a circuit breaker, you know, that becomes really easy for them to understand. And it makes your point seem much more, not only does it make you seem more compassionate, more connected and conscious as a provider, it also makes chiropractic seem less foreign to them, okay? So actually, that's a really good segue. Let's just jump into the analogies. How many of you use analogies in your practice? Yeah, you make it an effort? Good. So these are just some of my favorite analogies that I love. You know, dentistry has a lot of great connections to chiropractic. It's just so easy. First off, the one down here as far as ongoing, if you ever want to explain to a new patient about what the process for starting care in your office is going to look like. Hold on. Are you still with me? I can see my Zoom is doing something crazy.
We can hear you.
Okay, cool. Dentistry is a really easy way to communicate the kind of starting process of care. If I have a patient in the office and I'm explaining to them about the frequency of care and why in the beginning we're going to start seeing them more frequently and gradually spread their visits out, and then what wellness care or maintenance care or protection care or whatever you want to call it is going to look like, dentistry becomes really easy. Because if I talk to you about, hey, pretend for a second that you're 30 years old and you've never been to a dentist. You knew nothing about dental hygiene. You knew nothing about how to take care of your teeth. And all of a sudden your tooth started hurting, so you decided to call the dentist and get checked. Chances are they're going to find a lot of stuff to do. There's going to be stuff that has been accumulating over the course of 30 years. And it's going to cost more in the beginning as they see you more often, do more procedures to get your body or to get your teeth and your oral hygiene back to a relatively normal state. But they're not going to just say, okay, now that everything's perfect, wait until you get a toothache again. They're going to tell you, do the things at home, the brushing, the flossing, etc., and come back periodically for regular checkups. So not only can we help do a deeper cleaning, but we can also help detect any issues that happen early on. That's really the same concept of chiropractic care, right? When a patient comes into your office and they've neglected their spine for 3 decades, it makes sense that you're going to want to see them more frequently in the beginning. It makes sense that there's going to be more to do and it's going to cost more, and you're going to have to, do much more intensive work in those first few months. But it also makes sense that you want to periodically check to make sure that this doesn't happen again in the future. So I think dentistry is a really good, analogy for that. Now, I can't really see anybody now on Zoom. So just, if somebody can be responsible for just kind of saying, yes, I'm good, you can still hear me.
We can still hear you.
Cool. Going back to that, braces, I mean, this is a pretty classic chiropractic analogy, talking about the role of braces and orthodontistry. Anybody who's had braces understands that you don't put braces on one day and then you take it off the next day and your teeth are perfect. People who have had braces are used to the concept that these braces are going to take time to retrain your mouth to stay in that normal, that aligned position. And in the beginning, you go and you get regular tune-ups, or don't they call them adjustments? I never had braces, right? But don't they call like getting your braces adjusted, like, or changed or altered?
Yeah.
Yeah. So like if you talk about, yeah, they're going to put the braces on and then they're going to make periodic adjustments and they're going to allow your body to get used to to the process. And then after your braces are done and your teeth are aligned, in many cases, they might recommend a retainer for you to wear at night for the rest of your life. Otherwise, your teeth are going to go back out into their position, right? From a chiropractic perspective, you've built however many months, years, decades of your life developing muscle memory and movement patterns as to how your spine and pelvis and nervous system all work together. One adjustment is going to make a difference, but it's certainly not going to make any long-lasting difference in the grand scheme of everything that's been there. That's the equivalent of putting on your braces for one day and taking them off. What we need to do is stabilize your spine, and through regular periodic adjustments, get your spine to a place where it's stable. And then we can do the retainer, right? The periodic checkups to help maintain that, as opposed to needing to constantly, keep the braces on. So braces become a really good example for people, to explain to them the process of stabilizing their spine. Now, I will say, I don't know for this to be true, but I imagine the younger you are when you have braces, the less time you need in braces. Is there anybody who has like an orthodontist in their family? Is that the case? I'm just thinking to myself that, if you talk to somebody like, hey, your 7-year-old is going to hold their adjustments sooner because they don't have 30 years of muscle memory and movement patterns, it becomes a little bit easier to communicate, that. Now, the idea of pottery, I think, is one of my favorite analogies, because you hear this a lot in the terms of like pediatric population. The idea of, well, what am I going to, why is it important to get my child adjusted at an early age? Or, why would I want to adjust them before their spine has fully formed? Their body is just cartilage. It's not safe to adjust them. Carla, I've heard some of these things in school.
100%, yeah.
Yeah, and I totally get that mentality. But if you think about pottery, right? If you were throwing, I don't know, it's called throwing clay or throwing pot or spinning. If you were making something and you molded the most perfect piece of bowl or cup or whatever, once you put that into the kiln, once it starts to bake, that is it. There is no remolding. There is no changing. There is no repairing after that. That is going to be its form. In the same way, a developing spine is that cartilage. It's like that raw clay. It's still moldable. It's still malleable. It's still capable of changing its shape and changing its form. If you wait until a spine is fully mature before you try to adjust it and correct and stabilize its alignment, that's like waiting until the pottery is out of the kiln and then say, all right, now I'm going to rebalance everything. Versus if you make sure that as that child is going through these developmental milestones, as that child's spine and the joints and the ossification centers are maturing, if you're making sure that everything is doing so in a neutral position, that child is going to be more likely to have a normal spine and pelvis as their body matures and becomes, an adult. In the same light, you could also talk about, by the way, I forgot who asked this, about why it's the same adjustments over and over, right? I always like to say that in our care, you're kind of peeling off layers of an onion, right? To throw another analogy into this. And when you're at a very early age, you have experienced trauma, right? The birth process, being a kid learning to walk, falling on your butt, sports, school, etc. when you experience these traumas and the alignment or biomechanics of your spine or pelvis are off, right? That is going to create a compensation, which then the body in the future is going to compensate to again. And you're going to get these layers of compensations, right, that are forming and building over the course of a lifetime. And so for me, I don't know for any of you seasoned chiropractors out there, if you notice this also, Megan, I don't know if you notice this, is that when patients start getting adjusted, in the beginning, it's almost like every visit is a different adjustment as you're peeling off these layers. But when you get to the root of the onion, when you get to the original primary subluxation, very often it seems to be, the same couple of areas that need to be adjusted, right? Like I can tell when my patients get to kind of a wellness phase when, they're getting like the same 1 or 2 adjustments each time consistently over the course of time. Like I can tell, all right, we've gotten to the kind of the root of the issue. Now pretend, Carla, for a second that you're talking to a patient who's wondering why, they're getting the same adjustments over and over. Explain to them the idea of the pottery. When you were a little kid, your body was like this clay. It was malleable, it could be formed, and every time you experienced trauma, that changed the shape of the clay, right? And the subluxations that are present as the body goes through maturation, as you mature, as those ossification centers develop, and as the clay goes into the kiln, it kind of bakes in that this is the normal, this is the shape, right? This is the shape that joint is going to be in forever. So if that person has a subluxation at an early age before their spine matures, there's a good chance that the shape of their joints have actually formed in a way that predisposes that subluxation pattern. Does that make sense? If you look at—
that's really good. Thank you.
Yeah, if you look at upper cervical techniques, they talk about how asymmetry is the norm in the upper cervical spine. And the reason being is if you think about a newborn baby getting pushed through the birth canal and pulled out, and then the torque that it's exerted on their spine very early in life, that subluxation at C1 leads to asymmetrical pressure of the occipital condyles on the lateral masses, abnormal pressure from the lateral masses onto C2, abnormal range of motion, abnormal everything. And that becomes baked into how that child learns how to navigate and interact with the world. The sooner you address it and the sooner you can correct that subluxation, the better. But if you don't address it, if you don't correct it until years down the road or decades down the road, after maturation is already complete, then that upper cervical spine will forever have that asymmetry baked into it, which is why the upper cervical listing doesn't change all that often, if you're doing like orthogonal work. It's because the joint has formed, what is it, Wolff's Law? Right, the pressure, Megan's shaking her head, so I'm gonna go with that. That it fundamentally changes the shape of the joint, predisposing that joint to be subluxated, okay? So I really like to use pottery, and you can use pottery in a bunch of different ways, but I think it emphasizes the importance of the pediatric spine maturing into the adult spine. Now, HDTV is actually an interesting one that I developed. There was this thing that we used to do in school that we're going to practice a little bit later, so get ready. It was improv, where one person got the opportunity to stand at the front of the room and somebody would shout out an inanimate, any sort of object, and the person would have to equate chiropractic to that object. And it was a really cool exercise in thinking on your feet and kind of, learning how to communicate different ways in chiropractic. And somebody said television. And I said to myself, well, before high definition TV came out, we thought television was amazing already, right? If you look back at the old like sports recordings of like the late, the early 90s, you look at that and you're like, man, at one point that was viewed as like the pinnacle of visual entertainment. Like you couldn't imagine a crisper picture than that massive 60-inch tube that was 3 feet deep that would sit in your house and take up the entire living room. And then one day you were walking in Best Buy and for the first time you saw high definition TV. And it was the same program, but it was in a level of clarity and crispness and quality that you did not realize was ever possible. And in that moment, your TV at home became trash, absolute garbage. You couldn't possibly watch it. And for any of you who don't necessarily resonate because you're a little bit younger and you don't remember those televisions, think about the difference between like a DVD or Blu-ray and a VHS. All right, go watch an old VHS. You're gonna be like, I can't watch this, even though it's the same program. And this is a great way to describe the difference between living life subluxated versus unsubluxated. When you're subluxated, even if you think your quality of life is pretty good, you don't necessarily know what life could be like unsubluxated in high definition. When you're unsubluxated and your nervous system is able to perceive and respond to the world at a higher capacity because there's no interference, that's allowing you to experience the same world, but in a higher quality, in a way that completely transforms your enjoyment and completely transforms the way that you would interact with the program, with the world. That's to me, you know, sharing with people the idea of, yeah, you've been living your life in standard definition and it's been pretty good, but you don't necessarily know what high definition can be like for you. And that's actually also a really good way to explain to people when they ask questions like, well, you know, I heard once you go to a chiropractor, you always have to go back, right? Well, listen, I don't see too many people getting a high definition TV and then deciding to go back to standard definition. It's not that they can't, of course you can, but why would you want to? The quality is so much less, and for such a little investment, you can enjoy things on such a higher level. Well, with chiropractic, once you get through that initial investment, it becomes more about, you know, ongoing care. That it's you know, it's less than your cable bill. You know, it's less than the upgrade for high definition. So if you're going to spend that money to experience TV and entertainment at a higher quality, why wouldn't you do that for your entire existence? So I really like that analogy to help people see, especially those people who say, well, I don't really have any issues. I don't have any complaints. It's a good analogy to help them understand that they don't necessarily know what they don't know yet. Okay. The other thing that I really like in the similar capacity is a dimmer switch. I have in my exam room or in my consult room, a dimmer switch. And what I've liked to do is I start the dimmer switch at like 80%. And when I'm having a conversation with the patient, I'm talking to them about how their quality of life has been experienced through this filter of subluxation, that they don't necessarily know what's available to them because, you know, they're limited by what they've always known. And I use the analogy of, as this dimmer switch starts to decrease, your quality of vision, the ability to see, the light gradually decreases. And as a result, it eventually gets to a point where it's noticeable for you, and it gets to a point where it starts interfering with you doing the things that you need to do. Okay? This is a pretty good analogy for how subluxation can be there your whole life, and then it takes time for that subluxation to degrade your quality of life up until the point that it becomes noticeable, right? That the symptoms become conscious. So then I say to them, let's pretend now we start adjusting you. And as your nervous system is better connected, you start slowly raising the dimmer switch and the light starts to return to normal. But then you go past that 80% point from before and you really start to turn the light up. As that light gets higher and higher, they all of a sudden can see with a clarity, with a level of light that they didn't even realize was possible in that room. That's what life is like when you're living unsubluxated over a period of time. When your body has a chance not only to get back to the, you know, to where you thought you were before, but to reach a level that you didn't know was available to you. because your entire life has been subluxated and you've been experiencing the entire life at less than 100%. Now, this is actually a really good analogy, because what does subluxation mean?
Condition of less.
Say that again, you cut out.
The condition of less light.
Yeah, right? Subluxation literally means the decreased expression of light. So, to use a dimmer switch, I think is a really easy way of making that, resonate for somebody who's in the room. And I think the thing that I love about that is it's not just audio, right? It's not just something that you're telling somebody. You can actually show them and have them experience it, both in terms of you moving the dimmer switch, you communicating, and them seeing and experiencing the light. So it hits the audio, visual, and kinesthetic forms of learning that I think are really invaluable, okay? By the way, if anybody has any questions or concern, feel free to chime in. And then what I'll do is afterwards, if you have a specific topic that you say, how would you explain this to somebody? I'll create an analogy for you right now, right? It's just kind of my own little hobby. I mentioned, go ahead, Megan.
I just want to say, I spend these times, I do CBCT imaging, so I'm upper cervical nerd hardcore. And when you were explaining those, I feel like seeing CBCT images convinces me even more that moms need care through their pregnancy, and baby needs that. They need care when they're babies, because you see what it turns into when they come in 30 years later and they've never had care. So
yeah, for anybody who's not familiar, CBCT is a cone beam CT, right? And basically it's used a lot in dentistry, where they have you positioned and it rotates around you. Yeah, there it is. And it gives you a 3-dimensional view of the upper cervical spine that you can completely manipulate in all of these really awesome ways. And it's becoming the new kind of favorite among upper cervical doctors. But I think this is really the future research of subluxation and how we as chiropractors can measure it and analyze and correct it. So yeah, thank you for sharing. That was pretty cool. Maybe one time we'll do a little topic on imaging and perinatal practice, and I'll have you show everybody the cone beam. So yeah, I mean, obviously some of these are going to really be easy for you to communicate as somebody who does a lot of upper cervical work. The circuit breaker, this is a really easy one. Honestly, when I first opened up, I actually had little toys in the office that my wife at the front desk would give to people, and they would have to walk back and explain to me how it relates to chiropractic. And then we'd have a conversation about it. And it was a really fun little exercise. And one of the things that I had was a circuit breaker. I just went to Home Depot and bought a little circuit breaker. You could just print out a picture of a circuit breaker. And the analogy that I use on this is the distribution of the nervous system through the body, similar to how the circuit breaker splits up the power source throughout the house. Think about it in terms of this. Let's pretend you are using a lot of energy in your house, right? And you're increasing the demand in your bathroom. You've got the blow dryer, and you've got your lighted mirror, and you've got the electric toothbrush, and you've got all of these things going. And all of a sudden the power just shuts down, right? Well, obviously you can't do the things that you need to do. Now, most of us in society have become accustomed to just hooking up our appliances to batteries. Now that seems silly, but if something doesn't work, you just hook it up to a battery and now you can use it. And then when the battery runs out, you replace it and you get a new battery. And if that seems silly to you, what do you think we do as a society in terms of the temporary relief or temporary treatment with medication or, surgeries? It's very much this temporary, well, let me get things working in this moment. And it doesn't offer any, consistent or permanent, effect. And we have to understand that it makes far greater sense to go to the circuit breaker and flip the switch where the power's been shut off. From a chiropractic context, we're going to find the area in your spinal column that has flipped its switch and is affecting the supply of nerve activity to whatever muscle, organ, and gland in your body. And in doing so, it's going to allow your whole system to work better as a whole, as opposed to constantly trying to live on batteries, right? So that's one analogy. That's kind of a simplistic analogy. It's almost like the garden hose, right? You step on the garden hose, it cuts off water, it leads to the sick garden. Honestly, it's a really good analogy. I think people kind of, you know, bash on those things, but it's simplistic because it makes sense and people get it. You could also take it from a different context. I like using this in terms of, there's kind of a theory that a subluxation is an adaptive response in the body, right? Because you have to kind of ask from a philosophical context, if innate is always working to help protect the body, why would it create a subluxation, or why would it allow for a subluxation? And so is a subluxation something that's good for the body or bad for the body? You hear this like kind of philosophical debate that I really love. I just, you know, I think there's so many ways to approach it. But think about it in terms of this. If you have a power surge, right, coming into your house, the circuit breaker might flip as a way of preventing the entire house from being overloaded, right? It might flip as a way of protecting the input. And in the same way that when you are experiencing incredible physical, mental, or physical, chemical, or emotional stresses, the subluxations in your spine show up as a way of cutting out the sensory overload to the brain. And what we need to do from a chiropractic standpoint is reset the circuits, and you need to change your lifestyle to not overwhelm your body with all of those stresses. So that's another way that you can take the circuit breaker and kind of bring it to, you know, incorporate some lifestyle components if that's something that, you know, interests you, so to speak. Now, fingerprints on glasses. This is a really good one to use if you have somebody who is in your practice and you know, you happen to see that they're wearing glasses or they brought sunglasses with them. Simply put, ask to borrow their glasses and take your fingers and just like rub it on the lenses and give it back to them. And ask them to go about the rest of their lives looking through those glasses. And ask them how they feel. And ask them how it would affect their quality of life. How would it affect their safety driving? How would it affect their visual cues in social situations? How would it affect their you know, enjoyment as a whole? And then simply put, ask them like, well, if that's not good enough for your overall quality of life, then what are you going to do? And they're going to take it off and they're going to clean their glasses and they're going to put them back on. Say, awesome. Every day in life, in the same way that you're accumulating schmutz on your lenses that you periodically clean on your glasses, you're also accumulating stress on your spine and nervous system. And when these subluxations show up, they're the fingerprint on the lenses that make it harder for you to experience and respond to the world around you. What we're going to do, simply put, is clean your lenses. We're going to get you adjusted to allow you, your nervous system, to perceive and respond to the world without any interference, without any of that schmutz getting in the way. It's kind of simplistic, but honestly, like, I kind of love how it's interactive. And you can so simply alter somebody's quality of life by just touching their lenses. So that's something that you can play around with. I mean, some of these you need to get comfortable with the idea of getting in people's spaces and affecting them, okay? This idea of the water glass, I think this is a good way to explain, like, well, why do I need to be adjusted more during this time? Or why is it that, I was able to go a couple weeks and I felt amazing. And then this last week, the adjustment, it only lasted 2 days, right? You hear that, the adjustment lasted 2 days. Pretend for a second that you have an 8-ounce glass, right? That 8-ounce glass can only hold 8 ounces of water. And pretend that there's water that is slowly pouring in, It can either be a drip, 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 or it can be a steady stream, or it could even be a gallon of water that's just emptied directly on top of it. That glass can only hold so much. And once it overflows, now that water starts pouring out and it starts ruining whatever it's pouring onto, okay? Every day in life, you are experiencing physical, chemical, and emotional stressors that are either a drip, drip, drip into the capacity of your body, or it's a steady stream, or sometimes you get into an accident or you have a loss of a family member. It is just a bucket of water dumped on you. And no matter how well adjusted you are in that moment, it can exceed the capacity of your body to handle and adapt, right? Or it could be the drip, 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 and it's just over the course of a long time. Or it could be a steady stream that overwhelms you sooner than you expected, just based on the quality of, just based on your lifestyle, right? And so the idea in this analogy is you help them understand kind of visually what it would look like to have the physical, chemical, and emotional stresses reach their own capacity in their body. And you talk about how your lifestyle can help to slow down the flow of that water, or depending on your choices, it can speed up the flow of that water, right? Chiropractic is going to help do one of two things. You can use this as an analogy that says chiropractic is going to pour the water out safely in the sink so it doesn't overflow, or you can say chiropractic is going to help you get a bigger cup, right? So that your body can handle more. Because let's be honest, when we talk about how stress affects the body, there's two parts, right? There's the amount of stress that you accumulate versus your adaptability. You can have very low level of adaptability and it doesn't take a lot of stress to overwhelm you. You could also have a very high level of adaptability and it takes a lot of stress to overwhelm you. So you want to find ways to communicate that concept, because you want people to understand that chiropractic is going to increase the capacity to adapt to stress, but you are responsible for reducing the stressors in your life. Now, this is where it becomes really important to convey the active participation aspect of your care. You are not here to adjust them and allow them to live the same crappy lifestyle that brought them into your office without any expectation that they need to make any changes to their quality of life. Okay? I tell people my job is to correct your subluxations, enhance your adaptability, and allow your nervous system to better regulate and adapt and heal. Your job is to change your lifestyle and reduce the stresses so that the amount of stress you're accumulating gets below that adaptive threshold as quickly as possible. So you need to cut out the trash food. You need to cut out the cigarettes and the excessive drinking and all the things that you need to cut out, because that's going to make this process harder on you, and you're not going to get the results that you want, right? It's totally okay to help encourage people to be an active participant in their care. Now, one last one that I used earlier today, the idea of discs. And when I say discs, I mean like literally like, you know, the intervertebral discs. Somebody asked today, they said, well, I have a bulging disc. You know, I have a herniated disc and my doctor said that there's nothing that can be done about that. And I wanted to explain to them, because, you know, I mean, listen, you can do traction, you can do other therapies, and that's fine. But, you know, I wanted them to understand from a subluxation standpoint that this matters. And I showed them a picture of the spine, and I said, these are the discs that we're looking at. I want you to think about the disc in two ways. The first is I want you to think about it as a sponge. The disc doesn't have a lot of nutrient flow. It doesn't have a lot of blood flow. It doesn't have a lot of like, you know, fluid coming into it. So it gets most of its hydration from movement. The motion in a joint helps to squish and move and put pressure on that disc that allows it to absorb and eliminate, right? Absorb nutrients and eliminate waste. And the analogy I like to use for this is a sponge. If you put a sponge on a thing of water, it's just going to float. No big deal. But that sponge needs motion in order to absorb the fluid and eliminate other fluid. The disc needs motion. And so just because you have, if you have a bulging disc, just because you're out of pain, that doesn't mean that you're doing any long-term good for your for your overall spine. If you've got a segmental motion, a motor unit that is not moving, that is going to slowly put strain on that disc. And it's going to dehydrate. And this is where you get into the second part of the analogy. Pretend that disc, while it gets its nutrients like a sponge, imagine the disc is like a donut, right? Like a jelly donut. And you've probably heard this analogy before, but I like to tell people the outside is like the pastry. Those are the annular fibers. And the jelly on the inside is the nucleus. When that disc, when that donut is hydrated, when it's got normal motion and that disc is hydrated, those outside fibers are really strong and resilient. But when that disc has not been getting normal motion and therefore it's dehydrating, those outer fibers start to weaken. And as a result, it takes less stress for that jelly donut to be squirted out the back end of it, right? It gets less stress for that nucleus to bulge through or break through some of those annular fibers, and as a result, create some of the symptoms that people are talking about. Now, I explained to them, you can do things like traction that will help create a negative pressure. This is where Cox flexion distraction or even one of the traction machines can come in handy if that's the clientele that you serve. But it's also where restoring normal motion to those joints, ensuring that the spine is moving the way that it's supposed to, will help make sure that that disc gets the nutrition, the hydration that it needs to prevent it from worsening or to prevent other areas from, following suit and also herniating. And so I like to use these two analogies because I want people to understand that it's not enough to just feel good. It's great that you're going to feel good. And I told this patient today, there's a good chance that in a couple weeks, if you did nothing, you were going to feel fine, back to normal. My concern is what happens when the joint hasn't been moving and it continues to wear down and dehydrate. And then the next time it doesn't just bulge, but it completely herniates or extricates. What happens then? Right? And from a chiropractic concept, she now understood that, so getting adjusted regularly will help ensure normal motion in my spine and help minimize the likelihood of a future injury and impairment. And she totally, got that and she saw the value in that. All right. So when I talk about these analogies, the truth is you can create an analogy out of anything, right? Give me something that you think that sounds weird as far as creating an analogy out of. Look around your room and pick an item.
A vase.
A vase, like a vase. A vase, a vase. Okay. So, I would say, you could do it in a bunch of different ways. Like just off the point, the way I like to think about it is you start by thinking about, well, what's the function of this item? And then how would malfunction show up? And how can you relate that to chiropractic, right? You could also talk about the overall design of the vase and the stability. You can talk about how a well-designed vase will be able to not only support the structure of the flowers and the water, but it'll allow you to, enjoy and smell and arrange the flowers without being unstable. Whereas a poorly designed vase might look really pretty, but not necessarily be very functional. There are a lot of people whose health look good, but they may not be able to tolerate as much, or they may not be able to work as well because the function, the way that their body is moving in terms of that neurospinal relationship isn't working, as properly. It's making them more susceptible to falling down and shattering, right? It makes them more susceptible to, falling over or spilling. You could also talk about how like a little chip in the vase makes it weaker, and that over time, if that's not sealed or if it's not stabilized, it'll eventually continue to wear down and cause a leak, right? There's all sorts of ways that you can go, but honestly, just think about an item and ask yourself, well, what is it supposed to do? And what would happen if that, wasn't working, right? And then, figure out how you want to do that. So you can do this in a lot of different ways. If you want to talk about posture, for instance, it's very easy for people to understand that if they hold a bowling ball here, it's pretty easy to hold. But if they hold the bowling ball a couple inches forward, it becomes a lot heavier. They've experienced that. Most people have gone bowling. So then you relate it to their posture and their head. As that head goes forward, it dramatically increases the amount of work that the muscles in your neck and upper body have to do. Everything that you can do and practice is about finding creative ways to communicate some of these things. I would often talk about a chain. I actually bought a little link. I went to Home Depot and I got 24? I bought 24 links, and I used that to represent the 24 bones of the spine, right? Not including the sacrum. And I would explain to people that here's your chain. And when we adjust the top, right, and and I move the chain, you can see all the other links start to move. And then I say, and then we adjust the bottom, and I move the bottom, and then those links move. And what they see is that those forces meet in the middle. And I noticed in my practice, because I do a lot of Thompson, I don't do a whole lot of like thoracic adjusting. I noticed that in the first couple weeks, as we're adjusting the cervical and the lumbopelvic spines, that we see that they notice that they get like this area in their thoracic spine that just doesn't feel right. It feels stuck. They often say like, it feels like it needs to pop. And I take out the little chain and I show them that when one end rotates this way and the other end rotates this way, it meets in the middle and it creates a lot of tension. What we're doing by adjusting the two ends, we're helping everything, kind of meet in the middle. That's why you're feeling it. That's a good thing that you're feeling that tenderness. It means that your body is responding well to the adjustments. And once everything clears out, you're going to have a chain that works together as one instead of separate individual links, right? So that's an easy thing. You could also just simply say you're only as strong as your weak link. That injury you experienced when you were a child, that's going to be the first area that the stress is going to overwhelm and create symptoms for you, right? Or it's going to be the first area that the subluxation will return. That's one of the ways, Carla, that you can describe the same subluxations over and over. And use this from your experience. When I was in college, my wife decided that she wanted to rent a wave runner. And she decided that she wanted to drive, which sounded fine until she started gunning it up 10-foot waves. And I came crashing down on my butt, jamming my spine, having an occiput that locked down and caused me a migraine for 3 weeks. When my chiropractor finally adjusted it, it felt like an explosion. But guess what? 15 years later, that is the first area that I subluxate. The first area, every time. If there's one area in my spine that needs to be adjusted, it's the upper cervical area on the left, whether it's C1 or occiput. And it's because I injured that joint, and the ligaments and the muscles and even the actual joint has been damaged. And yeah, chiropractic helps, and it absolutely makes a difference in allowing my body to better adapt. But that's the weak link. That's going to be the area that will continue to show up for me, right? So that whole, you're only as strong as your weakest link becomes really easy for people to understand. Now, let's say, for instance, that you're talking, and again, so here's how you apply these. If you're talking about, the frequency of care, why do I need to come so often? Well, that's where you can talk about the braces. That's where you can talk about the dentistry. When do we reduce your care? Well, we're going to reduce your care when your body is well adjusted and you're holding and everything looks good. And you can start using some of these analogies and incorporating them in there. Let's see, what are some other ones? Well, first off, let me ask this, because I want this to be interactive. So what questions, comments do you have after we talked? Come on, somebody's got something to share.
I just want to say I'm really impressed by that base analogy. I had no idea where you were going to go.
Honestly, I didn't have any idea where I was going to go until I did. But this is actually a really good way, right? All right. So who's going to, who's going to be a simple experiment? Who's going to take a turn at improv? You're going to be unmuted, and I'm going to list a random item, and you get to take a shot at trying to communicate chiropractic. And it could be anything. I mean, it could be, any concept within chiropractic or wellness or health or anything. Because the idea is that if you're trying to convey an important message about something, that you can, in a split instant, talk about something and make it relevant with an analogy. So who wants to go?
I'll try.
Okay. All right. So, does anybody have a recommendation for an item?
That's a big dog.
Let's do this. An exit sign. You're looking at the exit sign in your clinic, aren't you?
Yes, I am actually. That's funny. Right there. So the analogy on what subluxation is with an exit sign?
Anything chiropractic related. It doesn't have to be about subluxation, right? Because people come in and they want to talk about a lot of issues. They want to talk about a lot of things. So anything that you might, like a conversation that you might have in your practice.
Regarding an exit sign.
That you can use an exit sign to describe, or make it relatable.
Okay. Okay, so you guys see that exit sign over there, right? Bright green, lit up. It lets you know that if anything was to happen, if there's a fire going on, that is the way that you go out the door. So you see, that is what your nervous system does as well. The brain controls everything in your body. So when your nerves are blocked or there's interference in your spine, you won't be able to see that exit sign lit up. So you wouldn't know where to go. And when that happens, it's just like when you have symptoms like blah, 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 blah. I don't know, pick one, headaches or whatever. That is your brain having interference, so the headache comes on and you don't know how to exit from that because your body isn't talking to your brain.
Awesome. So, and you can kind of, as you practice this, you'll be able to take the concept that you want to do and make the parallels a little bit more like clear in nature, right? So you can talk about that, a couple different ways. You can talk about like, hey, that exit sign in the case of an emergency is going to light up and start flashing and warning you that there's something going on and that you need to get out. Your body's symptoms, right, are the warning sign flashing to you that there's something wrong in your body that needs attention. Now, most people have been trained to just put a bag over it or cover it up or silence it. And as a result, that hurts, whatever. You can kind of go down there. You could also go along the same way that you did, is that, the exit sign is communicating to you that this is what you need to do. Your nervous system communicates to you, all the different body parts, what it needs to do. And if there's an exit sign that's not working and it's making it so that people in a certain area of the building can't get out, that's similar to how a nervous system that's blocked from the subluxation might affect certain parts of the body and not necessarily affect others. So you can go in like all different ways. But what's really cool is that you just kind of thought to yourself, well, what's an exit sign do and how is it relevant? So that was awesome. Thank you.
Thanks.
So like, that's the idea of this, right? The idea is that you can literally, if you had somebody in front of you who was an electrician, in that moment, you can think about an analogy that would relate chiropractic to what an electrician does. If you had somebody in your office who was an accountant, you can immediately, in a second, explain to them, you know, in an analogy that would make an accountant excited, you know, what chiropractic is. It's all about kind of making it relevant to them. And that kind of goes back to what I talked about here is, you know, what matters to them. Just because you like an analogy doesn't necessarily make a whole lot of sense. Like, for instance, I once tried to use an analogy about cell phone reception. I would talk about like, hey, look, I've got 5 bars. 5 bars means I have a better connection and therefore my conversations will work better. And when I go to this side of the house, I only get 3 bars. And those 3 bars mean my connection is less efficient, which means that some words might get dropped and blah, 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 blah. And I used this on my grandmother. And my grandmother was like, huh? What's the bars? Like, you know, it wasn't relevant to them. You know, so you have to find a way to make it resonate, you know, with them, so that way they get it. Okay. Now, one other thing that I want to talk about, or, you know, another thing that I want to talk about is the concept of an elevator speech. A lot of people, by show of hands, how many of you have struggled in the past to communicate chiropractic in a concise and efficient manner? Right? Like, you ever get the person, well, what's, you know, oh, what is it that you do? You know, like, it's sometimes hard to articulate that. And especially in this world of like pediatrics and pregnancy, it's particularly tough because it's not just like a, you know, many of us don't want to necessarily be thought of as a chiropractor, right? Because a lot of people's perceptions of what chiropractic is doesn't necessarily match up with what it is that we do in our offices. And so it becomes important that you develop a concise way to explain what it is that you do. And this concept, these 4 points, are something that I've learned very early on. This actually I learned from Steve Perman, who I'm sure learned from somebody else. The idea of the 4 ways, you know, the 4 steps to describing chiropractic. The first is your body is self-regulating, self-healing, self-adapting. You can say there's an innate intelligence. You can say that your body is designed to be healthy. However you want to frame it, the concept is simple, right? The second part is the nervous system is what regulates how the body works and regulates the ability of the body to coordinate its complex function, right? In order for you to be healthy, your nervous system has to be, communicating clearly and, you know, effectively. The spine is designed to protect that nervous system, but when trauma causes the spinal bones to shift or subluxate, that disrupts the nervous system and makes our body start to get sick or whatever, right? You can kind of spiral downward. Chiropractors adjust the spine, reducing subluxations and allowing the body to work better and heal, right? 4 points, super simple. The key is to make it personal for the person that's in front of you. That's the key, because honestly, if you just have like the same script, right, that you're using for every single person, it's not going to feel authentic. But if you have, for instance, have a person that's pregnant in front of you and you start talking to them about the miracle of life that's inside them, and your body knew how to take a single cell from a sperm and a single cell from an egg to create one cell that has now formed into a body that your body, you know, formed into a little baby that your body knows how to grow and how to give birth to and how to nourish from your body. And that the nervous system regulates that entire process. But when the spinal bones shift, it disrupts the nervous system, causing problems. we correct that neurospinal function so that all of that miracle that's happening inside you can be working as effectively and clearly as possible. You see, in that case, I spent way more on number one than I did on the others. Because if I'm talking with a mom, I'm going to want her to connect with like the miracle that's happening inside her. And oh, by the way, subluxation might interfere with that. You don't have to spend a lot of time on all the other stuff. You know, if you're talking about a child, hey, your child is perfect. Your child has the full potential of their development. The nervous system helps their body stay healthy and develop properly. But when the spinal bones misalign, it affects that and it makes kids sick and unhealthy. Chiropractors adjust the spine to allow the nervous system to let your child grow the way that they can. Bing, doors open, you're out, right? Type of thing. You want to be able to develop a rhythm that you can communicate these four principles with anybody. And you can literally pick, I mean, an athlete. You can very quickly talk about performance and talk about coordination and talk about, you know, the healing and the human condition. And then you can talk about how the nervous system regulates all of that, but it can't do so if the spine is interfering with it. So we correct the spine to allow the body, them to tap into all of that, you know, healing and recovery and coordination, etc. So you want it to be something that's going to make sense for them, but you also, ideally, you want to try to tell it as a story. And I think this is where, especially when we talk about like children, it becomes difficult for people to really understand because we don't communicate it as a story in a way that really lets people remember. So what I mean by that as far as a story is if I'm talking to somebody about the developmental process of a child and how subluxation affects children, I might explain to them, do you remember when you gave birth? And I say, yeah. I said, was that an easy process for you or was it challenging? Says, oh, I needed the epidural. It was excruciating. Said, okay. So as baby's head was being pushed deeper and deeper into your pelvis, the intensity of that pressure was so much for you that you needed to numb yourself. But the exact forces that you were experiencing were also being put on baby's neck and upper part of their head. And so in the first moments of their life, they're being pushed and squeezed, and eventually the head pops out, and very often the doctor grabs the head and pulls or yanks or twists. And in that moment, when that top bone starts to misalign, it affects their feeding and their digestion and the way that their body is able to regulate everything. And so what we do is, rather than waiting for kids to get sick and trying to treat them or numb them or suppress symptoms or etc., we want to identify that area and correct it to make sure that their body can develop properly without any interference from that bone. Now, you see how in how I communicated that, it was a little bit more like as a story, it landed more, right? It had a little bit more of an impact. So that's one of the things to keep in mind, is try to incorporate story and make it something that's gonna, you know, be significant for them. Now I want to hit a couple of these topics. So who asked, you know, people have been to other chiropractors? You know, you have a patient who's been to other chiropractors and they want to know why you do things differently.
Me.
Okay. So here's the thing, is you're absolutely right. You don't want to crap on other chiropractors, right? But you also want to distinguish you as somebody who's different, because a lot of people assume chiropractors are all the same. And so especially if you do a different technique, or, you know, if you have a cone beam CT that takes amazing, you know, images of the upper cervical spine that allows you to be more specific, like that's something that's a distinguishing feature of your practice that it's important to be able to communicate. So what you want to do is don't denigrate, don't, you know, crap on them, but talk about what makes you different and why your approach is ideally suited for them. So what I mean by that is, oh yeah, a lot of chiropractors do the twisting, popping, cracking, and I totally get why that, you know, why you like that. It definitely provides that immediate relief. The problem is sometimes those adjustments may not be as specific, and therefore your body doesn't hold the adjustment as long as you otherwise could. Did you ever feel like you went to the chiropractor, you got adjusted and it felt good, and then a couple hours later you felt like you can get another adjustment, or a couple days later you felt like you needed to go back? That's because that bone just shifted right back into its old habits. Our analysis and our technique allows us to adjust your spine in a very precise manner that will help you hold the adjustment longer. So instead of having to constantly come back and get adjusted, we're making more of a corrective process and stabilizing your spine so that way we can go forward. Now, our approach isn't for everybody, and that's okay if it's not right for you, but this is what we do in our practice. Never feel like you have to be all things for all people. It's completely okay for you to say, hey, I totally get why you love that. That's just not what we do, you know? And here's a practice down the street that if that's for you, that's totally fine. But you want to find distinguishing features. What makes you different? What makes you special? What makes you worthy of driving past other chiropractors to visit? Figure that out. And by the way, it's rarely the technique, right? Because all of a sudden a chiropractor opens up next door to you and they practice the same technique and you're like, well, shit, you know, what am I supposed to do now? It's very much about like your mindset and your philosophy and your overall approach and how you go about doing what you do. It could be that, yay, in addition to correcting the subluxations in your spine, we incorporate wellness changes and lifestyle things, and this is how we, you know, we do it. Figure out what it is for you, and that way it can land more effectively, right?
That was fantastic. I definitely am going to re-listen to this for many things, and for that, I struggle when people come in because they talk about how they've been to other chiropractors, and they're like, but I feel it like in my back here. I'm like, okay, like I understand that that's where you feel it, and like try to talk through, and I'm like, but I'm not going to do that.
Well, this is
like,
yeah, you almost feel like you're disappointing them.
I do, and then they get like 1 or 2 pops, and they're like, but I'm used to like the whole neck going, and they're like, I will see if this works. They don't say it like that, but you can like sense that tone. And I'm like, crap, I'm going to lose them after 2 adjustments because I'm trying to do my best.
This is where you need to create that distinction in your initial consultation. You don't want any surprises in care. You don't want them to be like, oh, I was expecting this. I was expecting the heat pad. You guys don't do that here? Oh, it really helped me loosen up. I was expecting to get a massage. You guys don't do that? You know, like, so preface all of that in your consult. That way there are no surprises. And now your conversation is, oh yeah, I totally get that, feels better. But most of the time where you're feeling it is the compensation, not necessarily the problem. And so if you notice today when we adjusted your low back, your left side of your pelvis is where you've been experiencing the pain, but we had to adjust the right side of your pelvis. When that right side is locked up, it forces the left side to move more, which is what creates the discomfort. And that's why we're not chasing your symptoms, but we're correcting the underlying cause.
I've been resorting to, well, I go through a couple of things, but one of my big things when people talk about what another chiropractor did, I always say, I'm like, well, any chiropractic is better than no chiropractic, but we're more specific. And I just kind of like, we haven't been open that long, and like I didn't graduate that long ago, but
that's okay.
Talk big about it. And I'm like, listen, like we see people all the time who are getting amazing results with what we're doing here, and we're really confident about the kind of care that we're providing. I really think that we can help you. And I just explain how it's going to take some time because I use the braces analogy, and they do like, they all get better. I just feel like sometimes I get anxious about the fact that they may leave after 2 adjustments because they don't get it, because the pain is gone.
So in our consultation, we tell people that if you're going to get started, there's a minimum expectation of time that you're going to give this. That your healing is going to take time and repetition, and we're going to need to see you, you know, 1 to 3 dozen visits over the course of the next couple months, depending on what your body needs. And our adjustments are going to help, you know, here's another way I like to describe this. And I think this will really help you in this issue. let's pretend for a second that you have this subluxation and it's weakening the nerve, or it's interfering with the nervous system, causing dysfunction, causing pain or disease or sickness or whatever, right? You've had that for years, and we adjust your spine, we restore normal motion, we reduce the subluxation. In that moment, your nervous system is able to better communicate and coordinate function in every part of your body. Over the course of the next couple hours and days, though, the muscle memory and movement patterns that you've developed in your life are going to start pulling things back. And in the moment that subluxation returns, it halts the process of healing and it slowly starts your body regressing back into old habits. That's why we need to see you more frequently in the beginning. And as your body slowly starts to hold the adjustment longer and longer, it means more time for your body to heal. It means more time for your body to get better and better. Eventually, we won't need to adjust you. Your body will be stable. And that means your nervous system is regulating your body consistently. And that's when real healing really takes place. Here's an example. This is a story. And by the way, feel free to steal the story. I had a 35-year-old gentleman who came into my office, and he had 20 years of ulcerative colitis Crohn's, inflammatory bowel disease. And we started adjusting him for his low back pain, and his low back pain went away. And what he noticed was over the course of his initial set of visits, right, his initial 24 visits, his flare-ups started decreasing in frequency and severity. And we kept adjusting him. We saw him like every other week after that. And then we saw him once a month eventually. And our goal was, we're going to adjust your subluxations wherever and whenever they are there. And the only way that we can mess this up is by not adjusting you when you need to be adjusted or adjusting you when you don't need to be adjusted. Our job is to clear the pathway for your nervous system to let your body heal more appropriately. And so as we were doing that, he noticed that his flare-ups started becoming less and less prevalent. And eventually he went back to his GI and they did a colonoscopy. This is 1.5 years into care. And he realized the GI said that his colon had completely healed and there was no signs of any inflammatory bowel disease. I would never in a million years say that chiropractic cured his inflammatory bowel disease. And it wasn't even treating his inflammatory bowel disease. But what happened was his nervous system, when it was subluxated, it didn't allow him to create healthy cells and create healthy tissue and a healthy organ. But over time, as he started holding the adjustments and his nervous system had more time to work efficiently, it allowed his body the freedom to create healthy cells and enough healthy cells to create healthy tissue, enough healthy tissue to create healthy organ. That's what happens over the course of time. It's not something that happens 1 or 2 visits. You did not get here in 1 or 2 days. You got here over the course of the last 20, 30, 40, 50 years of physical, chemical, and emotional stresses bombarding your body. And this, where you are right now, is the best your body's been able to adapt to it because of these subluxations. We're going to be able to help you, but it's going to take some time. And if that's not what you're looking for, that's okay. But it's going to take some time. And as we get your body stable, your body is going to have more time to heal and properly regulate, and you'll notice things will get better. But you need to be patient. Preface that up front. Don't let people get away with this, well, I'll try things out. No, listen, if you're going to get started, we're here to help you. But our expectation is that you're going to commit to pick a number for yourself, pick a number for the patient. It might be, for kids, for like young babies that are in my office, you're not starting unless you're committing to 12 visits. Sorry, it's going to take me a couple visits to figure out your child. It's going to take your child a couple of visits to warm up to me. Then it's going to take a couple of adjustments to get everything stable. And then we're going to start spreading out those visits as your child has more time to heal. No, if you're going to give it 2 or 3 visits, no thanks. Don't. You're going to waste your money. And I'll tell them that. I said, there's, you coming in for a handful of visits and not giving it enough time, I mean, I'll take your money, but it's not going to do you any good. I would much rather you take the time to follow through and give it the minimum necessary visits to see a change. And yeah, fingers crossed, you'll see a change right away. More likely than not, though, it's going to take a couple of visits before things really start to change. And I don't want you starting if you're not willing to give us that opportunity. You would never go to a pediatrician and say, oh, my child has eczema. Okay, use this cream once. Well, I used this cream once. It didn't help. Like, come on, like enough with the double standards. And it's totally okay to use that as an example and say, listen, I saw when you came in, you're on high blood pressure medication. Do you take that every day or you just did it once? No, you do it every day because you know that medication only lasts a short time. Well, right now we're fighting with muscle memory and movement patterns that have been there for decades. So yeah, the adjustment, it might only last a couple of hours before your body shifts back into old habits. The good news about us, the difference between the adjustment and your high blood pressure medication is that you're eventually not going to need this every day. You're going to be able to start holding your adjustments and your body will start to work better instead of becoming dependent on chiropractic. And that becomes very uplifting. And now it becomes a celebration when they're holding. And now it becomes an excitement that, oh, I don't need to be adjusted today. That's great.
I really like the you need to commit to understand and then explaining to them why it's important that they commit, and it's not like a 2 times and then you're better kind of thing, because I mean, we all know like people are really used to the quick fix.
Yeah.
But it's not a fix, and I'm great at explaining that to people. It's just bringing it back to, I guess you talking about like connecting the dots and then having like feeling like the authority. I was telling Chris the other day that somebody called and I'm used to being like, oh yeah, like I'm going to blame it on the organization or the boss. And I'm like, crap, we're the boss. Like, I have no one to blame it on.
The buck stops with you.
Yeah. But I think being the authority figure and just knowing what it is that we offer and finding a better way to communicate that, which loving this whole talk for that, by the way.
Yeah, I mean, listen, I had a patient who came to me and said, I really love, chiropractic. I want to do it a couple of visits and see if it can help. And, it was for like a breech baby or something. And I said, listen, honestly, if you're just going to give it a couple of visits, I'd rather you not. And she's like, what do you mean? I said, well, the likelihood that your baby, that we can stabilize your pelvis and give baby more room to turn in the next couple of, in 2 or 3 visits is pretty slim. But you're going to probably tell people that, you tried chiropractic and it didn't work for you. And I'm here to tell you that that's not really trying chiropractic. And if you really want to try chiropractic, we're here for you. And this is how we're going to do it. But if it's not for you, that's okay. We wish you the best. And I think that's the thing, is giving people the dignity of their own choice without having judgment attached.
I want to say, like, I've heard, and I respect that you would say that. And I've heard other docs that are seasoned, right, that say that. And I know me and Jaylene, like I opened on June 18th. So I'm not even like 2 months. And I feel that our fear with that statement, even though it is completely true, we're not, and I don't know if I'm speaking for Jaylene, but we're not financially stable enough to say bye to certain people right now.
Totally, 100%. So listen, you might be in a situation where financially you can say in the beginning, now I will tell you this is all of this happens when you don't land this point during the consult, right? Because if you start by saying, listen, this is what we're looking for. This is how it manifests for you. This is what we're going to do if we find it. This is what's involved in the correction of it, right? So we're going to make the adjustment. We're going to see you twice a week and we're going to do it for this many weeks. And it's going to be important to help your body get stable. This is, this is what's what we're going to be doing. Any questions, right? And they say, no, that sounds great. And then they come back during the consult or during the report and they say, well, I'll just do it a couple of visits, and say, listen, we talked last time about the fact that this is a process of stabilizing and correcting your spine. And the likelihood that you notice a significant change after a couple of adjustments is really slim. Fingers crossed it happens, but it's unlikely. And it's unlikely that if you do notice a change, that it's going to have any sort of lasting impact. So what we need to do is we're going to put together this plan for you. If you want to do per visit and you just feel like trying it out, we'll get started. But I'm telling you right off the bat, don't expect the changes that you're hoping are possible if you're not willing to give it the time. So you can kind of have both, right? You can, you know, I was there, right? Oh yeah, those 2 or 3 adjustments are better than sitting here twiddling my thumbs for the next hour. I get it. Do that, right? Do what you need to do to put, you know, food on your plate. Do what you need to do to keep your doors open. But remember, the results that you're creating are a reflection of the way of being and what you're doing that have brought you to that point. So if you're finding patient after patient not wanting to commit, not really sure, just wanting to give it a couple of visits, that's telling you that your way of being, your confidence, your certainty, your compassion, your presence, your connection, whatever it is, and way you're doing, what you're saying or how you're saying it, you know, the flow in which you say it, that something's not working, something's creating that result for you. Because now that gives you an opportunity to go back and do an inventory and figure that out so you can create a different result for yourself. As opposed to, well, it just keeps happening, this whole thing is just bullshit. Which is what a lot of people do, right? And then they feel like, oh, well, you know, this isn't working, now I need to go do something else, or now I need to join a group, or now I need to, you know, become an associate, or now I need to do this. You know, the reality is, yeah, you're going to screw up, and there are going to be times that things don't work out very well, and that's okay. The key is, are you going to be a victim of it by thinking it happened to you, or are you going to be accountable and say, yeah, something didn't work, or something worked in a way that created the result that I wasn't looking for. Let me figure out what that is so I can change it. So in those situations, I'll tell you right off the bat, it's your consult. There's something that you're missing in the consult that's allowing them to understand the chronicity of the subluxation, and that's allowing them to miss the process of their body healing. So play around with it. Record your consult. Listen back to it. Honestly, the first time I listened to my consult, I cried.
I love the idea of recording it.
Yeah.
I had to record mine for like the first 3 months when I was an associate.
Yeah. I mean, listen, if you're doing like the ICPA Diplomate program, when I got my Diplomate, I had to send Jeannie a video recording of my consult, my report, the first adjustment, you know, my exam process, and I had to send it to her, and literally like a committee like watched and reviewed everything. You can learn a lot from just recording yourself. So record yourself, and listen, follow state laws as far as the recording process, right? You can say, you know, you're recording this so you can, have a record for yourself, but it won't be shared or anything like that. Or, you know, if you're in a state where you don't have to, then just record it on your iPhone and then delete it afterwards after you listen. So, okay. I wanted to talk about the overprotective parents, because, you know, I know, you know, talked about that. Honestly, it's not about you. And what I mean by that is there's a lot of anxiety and a lot of fear and a lot of stress in the world right now, especially among parents, especially now. And there's a lot, you know, sometimes there's times where people are really fearful and they're uncertain about chiropractic, and they really want to be like all up in to, you know, watch and observe and figure everything out. And sometimes it's just because they're just scared, and it has nothing to do with you. It's not about not trusting you. It's just, they just don't understand. You know, I have people who come to me and they say, I'm going to see you, right? Like, I'm not seeing Dr. Nina, or I'm not seeing, Dr. Haley. Like, I'm going to be seeing you. And the reality is, I tell them truthfully, it says, well, you'll be seeing both of us. Now, here's where this can go wrong. No, you'll be seeing both of us. What does that feel like? Jaylene, what does that feel like?
Like a regular doctor, like they don't get to say they've showed up to the doctor visit and we're telling them what to do.
Yeah, it feels like cold and heartless.
Yeah.
Right? But if I said, well, we'll certainly take in your preference, but you'll get an opportunity to see both doctors. We like having two separate sets of eyes and hands so that we know that we're not missing anything for your child. You see how when I said it, I actually spoke into the value of having another doctor there. It wasn't just like no, you're not going to always be lucky enough to get me. It's like specifically like, hey, yeah, most of the time you'll see me, but you'll get a chance to see both of us, which will be really good. And guess what? A lot of times those people end up preferring my associates than me.
Question.
Yes.
What if, like, I adjust my patients, but obviously Dr. Leanne is here too, and she adjusts her patients, but we don't switch patients.
Oh,
but
well, then in that case, you can just...
During a shift, how would you explain that? Like, who is she, you know, or if they ask that, I mean.
Oh, yeah. I mean, you can talk, I mean, because by the way, there might be a time in the future that you have an emergency and she does have to adjust your patients, or you have, you know, you just had to go on vacation, right? The elusive vacation that chiropractors in their first couple of years never experience. You know, those things will come up. So I make it a priority to have people be introduced to our staff. You know, when I do, if I'm doing a consult, I have Dr. Nina go in and do the x-rays or the exam, because I want them to get an opportunity to experience the other doctors so that way they feel comfortable. And if I'm going to be doing everything, then I'll just say, oh, this is Dr. Nina. You'll see her around. You know, just let them know, like, hey, yeah, this is another chiropractor. Like, we're a vibrant family team. Like, we've got lots of, you know, providers here. We've got lots of awesome people here. And, you know, we're all here committed for you. So yeah, definitely let them know. So as far as the overprotective parents, that's totally okay. A lot of times it's just the idea of chiropractic for children is scary, right? It's like, you know, it's weird. And so they just want to watch. They just want to make sure that everything okay. And that's where you start using, like, hey, this is what we're looking at. You know, we're gonna palpate the child's neck and we're gonna gently feel the motion back and forth. And sometimes you can have them do this. Here, take your fingers and you feel that hard bone right behind your ears. Go down just below so that you're at the tip of that. Now tilt your head this way and tilt your head this way. Do you feel how the bones that your fingers are touching start to move differently? That's what we're feeling in your baby. And when we feel that one side that's not moving, or that's rotated, or that your child is aggravated by, or there's something that's there, that's what we're going to correct. And we're going to use a very gentle pressure so it's completely safe. And yeah, of course you can sit here and watch. You know, I've never in 9 years had a patient watch their child get adjusted and saying, you're not doing that again. That's just, I mean, if you're doing pediatric chiropractic right, that's just not happening.
Mm-hmm.
So, you know, as far as the idea of the inductions in pregnancy, I think the thing that you want to realize is we want to be able to help everybody, but wanting to help everybody doesn't necessarily mean that we can help everybody. And poor planning on another person's part does not necessarily constitute an emergency on ours. And I'll give you an example. I had a mom call us today, and she said, I am 38 weeks pregnant. My baby is breech, and I'm supposed to get a cesarean next week. Can you do anything? And I said to her, well, this is what we do. If you are serious about trying this out and preventing a C-section, we need to see you at least every day. And we're going to correct your subluxations, and we're going to help stabilize your spine, and you're going to be given exercises to do at home. And if you're going to give this a shot, make sure that you're ready to commit. And she said, well, I just don't know if I can. I've been seeing this chiropractor for the last couple weeks, and I've been going twice a week. And they haven't had any success with breech babies in the past, but, you know, I was referred to them. And so I'm just not sure if I'm ready to start up again. Okay. I would love to help you. And I mean, I have no idea, you know, what made you choose this other chiropractor who openly admitted they didn't have any success, you know, with breech babies, and clearly doesn't work with a whole lot of, you know, pregnant patients. But if you're going to get started in our office, this is what we're going to do. And I don't want you to come to my office and think that something's going to happen that may not happen, and then be disappointed or be resentful towards me or chiropractic as a whole, because then you go online and you say, oh yeah, I tried Dr. So-and-so and, you know, it didn't work. So you just want to be careful of that, you know. You know, as far as like things like, you know, being induced, and these are complex topics that go into not only the health of mom and baby, but also the emotional well-being and fear and the anxiety around COVID and what's going to happen in terms of like being tested before you know, well, I'm going to be tested before I get to the hospital, so I'm trying to limit my interaction with people in order to be in the office. Well, in that situation, you can talk about what you're doing to make things safe, but you don't necessarily, it's not necessarily your responsibility to, you know, pretend like you can guarantee they won't get COVID. Yeah, listen, this is what we can do. And I think it could be a tremendous help in terms of your pregnancy and preparing for birth. And if you're not leaving the house, I get it. You know, we're here for you if you decide you can. And I think sometimes we have the idea, especially in the beginning of practice, is that, oh, I need each individual patient. I need that patient. And I totally get that mentality. But the one thing that you also don't need is to try to cut corners and have somebody get a subpar result in your office and then tell other people that they tried your office and it didn't work for them. Or the last thing that you need is for, you know, you to go out of your way trying to make things work for somebody and them not reciprocate in terms of their commitment. So just something to, you know, to be aware of.
Can I offer something to the students? This is, so my first week this is about not accepting patients who really just don't vibe with what you're offering. I had a husband and a wife come in. They came in for their first appointment together. They came in for their second appointment, report of findings separately. The wife came in first. I presented her care plan to her, and she had a lot of questions. I answered them, took a really long time with her, and she was like, okay, I'm going to talk to my husband. She left within 30 minutes. The husband came rip-roaring through the door and was screaming at me. And I just looked at him, and he was like, I've been to chiropractors. It doesn't take that many visits to get out of pain. And I mean, I shook and I went and cried afterwards. Like, I bawled my eyes out, and I was like, oh my God, he hates me. Like, it's gonna be a bad Google review, and it's only a week. But he left after that visit. I looked at Chris crying, and I was like, we don't need him that bad. I don't want him here. It's a bad apple, and other bad apples will happen. And he came back, and he needed a referral. Like, his aorta was pretty large. So he came back, and I kept calling him. I was like, hey, you need to come in because we need to talk about this. And now he tells everybody how wonderful we are. But he never came in, but he tells everybody how great we are. So it was a situation that went like really poorly.
Yeah. I've had people that didn't start in our office, and they still refer people to the practice, which is kind of a weird thing. But it's interesting, you know, you bring up a different point, because this is like the, I don't know if you can see this, I put the skeptics section up there. These are things that you need to be able to understand the nuance of so that you can effectively communicate. And that way, like, they can land, you know, better. I'll give you a couple, I'll just run through them real quick just so that you have them. As far as stroke, if you're talking to a patient about stroke, they have concerns about stroke, the things that you need to understand is that there is no evidence that chiropractic causes strokes. There's plenty of evidence that chiropractic misses strokes. And what I mean by that is the chiropractor didn't necessarily identify it during their screening or during their, you know, history, okay, or during their evaluation. And so it's really important that you understand that, because now it gives you an opportunity to say, you know, somebody says, oh, I'm really nervous about strokes. I totally get why you'd feel that way. Let me explain to you what the information that you're missing. Chiropractic doesn't cause strokes. It's that chiropractors miss the diagnosis of a stroke that's happening in process, right, in progress. And one of the things that we do to ensure that that's not the case is we do a thorough history and evaluation to make sure that first and foremost, it's safe to adjust you. And if we can do that and know that it's good, we'll be able to adjust you confidently. If there's any doubt in my mind that it may not be safe, we're going to send you out for the appropriate imaging to make sure that it's safe before we ever do anything. Because my commitment to you before anything else is that you're going to be safe during this process, right? And a lot of times, you see like the article in New Australia about the baby whose neck was broken by a chiropractor. What they don't share is the fact that no, there was actually they pulled it. I forgot the term for it, where they basically said, oops, sorry, the baby didn't have a fracture. The baby had congenital spondylosis and the chiropractor wasn't responsible at all. So knowing these things, I think, are really important to help you, kind of calm people down. If you have somebody, well, once you go, you have to go forever. We kind of alluded to that with the, some of the analogies. Nothing changes, or it's only short term. This is where you talk about how this process for adjusting, we're peeling off layers of the onion, getting to the underlying cause of the issue. You want people to understand the chronicity of everything. We talked about the same adjustments. Jaylene, if you're talking about like somebody who says, well, I've been to chiropractors before and they didn't, I didn't need this. My response would be, I totally get where you're coming from. There are a lot of chiropractors that do good work helping people feel better in like short-term pain situations. That's just not what we do. We focus on correction and blah, 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 and you kind of go into there. So it's not about just shutting them down. It's about helping them see that they're missing information. And I'll give you, when I wrestled in high school, you would like, if you just pushed against, the opponent and you just pushed and pushed, you're not going anywhere. But if as that person's pushing, you move out of the way, you allow them to go right past you and you can control their body and kind of take over. Well, in terms of the conversation, if you are going to talk to them about one of these topics, the last thing you want to do is chiropractic causes strokes. No, they don't. You're wrong. And then just like be here, right? My pediatrician said that I shouldn't get my baby adjusted. Well, your pediatrician is practicing chiropractic without a license and they should be arrested. My doctor said you shouldn't adjust my neck. Well, your doctor is an idiot. Like you're just kind of like going back and forth. If instead you say, my pediatrician said I shouldn't get my baby adjusted. Honestly, if I didn't know what I knew about chiropractic, I would probably tell you the same thing. Most pediatricians think that chiropractic is the twisting, popping, cracking. If that's what it was, I wouldn't allow my child to get adjusted. But here's what we're really doing, and this is how we do it. So you're not making the doctor wrong. You're just saying that the doctor doesn't have all the information that the patient is about to have. And that allows you to kind of redirect. Oh, my doctor says chiropractic can cause strokes. I totally get why your doctor would say that. There's a lot of people who think that chiropractic causes strokes. Unfortunately, the earliest signs of a stroke are neck pain and headache, which are the reasons why some of these people who are very early on having a stroke show up to the chiropractor's office. It's not that chiropractic is causing the stroke as much as it is that the chiropractor isn't screening properly. One thing that you can feel comfortable with is that we're going to blah, 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 and you kind of go from there, right? But the idea is letting people, finding a way to kind of guide them into it as opposed to trying to fight with them. So Jaylene, in that situation, like, yeah, you're right. In other chiropractic offices, it doesn't take that long. In fact, in our office, it's probably not going to take that long to get out of pain. But our goal isn't pain. Our goal is this. And then show them where that is. Because if he's coming in and says, it doesn't take that long getting out of pain, well, No, I think she's going to be out of pain much sooner, but this is what we're trying to accomplish. It's more than pain, right? You're expanding the conversation as opposed to just limiting into one thing.
Yeah, I tried that. It still didn't, he was really angry. But he came in really pissed off, pardon me, and he left not mad, or at least not pissed. He just left still disgruntled, but like obviously he came back and now everything is okay. But
I just cut out. I completely missed what you said.
oh, I said that he like came in like really, really mad, and then when he left, he wasn't as angry. And I did explain, I was like, well, pain's the first thing to go away, but that's not what we're paying attention to.
Yeah.
He had been to over 200 chiropractors, he had said, and there was no like I don't think enough, I could have done enough explaining.
Yeah.
But it ended up being an okay situation.
Honestly, in those situations, like when, I've had a patient come to me one day and in the consult, they were talking about, oh yeah, I hated my last chiropractor. I had to sue them for malpractice because they hurt me. Before we even finished the consult, I say, I was going through the history. I say, you know what? As much as I'd love to help you, I don't think our approach is really, ideal for you. There's this office right down the street that I think would be a really good fit.
We did the same thing. We referred him like 2 blocks down. I was like, I want you to get the care that you deserve, and I don't think that's here for you.
And honestly, both the chiropractor and the patient later thanked me for it.
Yeah.
That's fine. So listen, I know it's late. We've gone a little bit longer, but I'm here. If anybody wants like practice and take a turn doing improv, I'm totally cool hanging out. If you'd rather like take some time to practice and think about some of these things, and then we can even, practice later on. I mean, I can just email you a random item and then you can write back like your description. That would be fine too. What do you guys want to do? I'm totally fine ending here, but if you want to talk about a couple more things, we can do that too.
Well, it is, what time am I on right now? I don't even know.
Oh, it's 8:30 and for you. I don't want to hear it.
Yeah, but I've had a double shift today, so I'm starving. But
Go
I love
eat.
you. Thank you. I'm gonna go get something to eat.
Go for it.
All right, bye guys.
Well, listen, thank you guys so much for joining. If we want to talk about some other things, feel free to email me. Listen, I need topics to talk about. I can clearly talk about anything for as long as people will give me a microphone, but I need topics. So I want you to email me with a topic of something that you feel like you need help with. It could be clinical in nature. It could be adjusting technique. I'll have a friend come here with me and I'll show you how to, set up and adjust pregnant women if that's, what you want. Tell me what you want, just email me, and that way we can, figure out what's going to be ideal, because I want this to serve you, not just, what I feel like talking about that day.
Can I ask a question?
What was that?
Have you done any, I know you're involved with OBs and pediatricians and all that, and I know you have a great way of getting to them to refer you, but have you ever done like a women's health fair and put all of them together at your office before?
I haven't, and I think that's a great idea. I think if you can organize, like for instance, I've done like a Facebook Live once where we incorporated several different practices together and we had like a roundtable discussion, and that was really fun. But I think that, anything you can do to build community and get providers to, see you as like an organizing authority of that community, I think is really helpful. Because people, it's not just about chiropractic, it's also about their trust in you. I mean, I've literally had OBs refer people to me by saying, I don't really understand chiropractic, but this guy's really passionate. So, I think that's a great idea. And honestly, it gives you an opportunity to really, go in depth, in terms of like relationship building with people. So I think that's a great idea. And whether it's at your office or a neutral place, it really doesn't matter. The part is that not only are you getting to all interact with mutual patients, but you're having your, these providers develop a sense of trust with you, which I think is really important.
Yeah. And I can email you too. I just, less than 2 months into practice, how do I go find people?
Well, it's not easy in the middle of a global pandemic either.
No, it's not.
But honestly, like, here's the deal. Find the people in your community, the providers, the support, the midwives, the doulas, the acupuncturists, the massage therapists, the pediatricians, the pediatric physical therapists, the prenatal physical, the women's health pelvic floor specialists. Find these people and connect with them. Your job is to establish relationships and referrals that you can refer your patients to. And you need to meet with them to understand if you can trust them as a provider and you'd like to connect. And in the process of you learning more about them, as a natural level of respect, they're going to ask you about what you do. And that's when you really emphasize how it relates to them. So, first, organize a list of the people in your community, the people that you want to connect with. And then you can start off by like sending an introduction letter, making phone calls. You can do all of those things through that process. And it honestly becomes like a really, it becomes a fun little experiment.
Yeah, fun.
Yes, Alexandra.
Thank you. I have a clinical question that maybe you can help me with.
Okay.
I have been taking care of a little boy who is 8 years old. He started care because of bedwetting issues. Okay. And I started adjusting his atlas on the left side. And the first month of care, we had 10 straight days of dry nights. Since then, we haven't made any impact into his bedwetting. However, his asthma and all other things are coming along. However, when he is not in pattern and when he's balanced and when I'm doing activator protocol checks, everything's clear. But when I palpate his right atlas and I usually adjust his left, it statically feels completely out. So have you ever noticed that with any of your children, and what would you do in that case?
Yeah, so sometimes if I innately feel like something's missing, I might not, I'll use my analysis, but sometimes I'll add other analyses based on what I feel is like, there's just something not right about this. I don't think they should be holding. And I'll do a couple of other things to try to, figure that out. What I've found, especially with young kids, is if I'm adjusting, let's say right posterior, and it's making some change, but either it's not holding or it's not really, what I'll do is I'll challenge and I might adjust the left anterior.
Okay.
Right? Sometimes that I've noticed, most kids don't have a big rotational component, but if there is a rotational component, you might feel one side that is rotated, but it's not the side of lateral flexion.
Okay.
So like, for instance, if that bone is ASRP,
right,
I'm palpating and I feel that's right posterior atlas and that feels really out, right? I might adjust it, but it could be that the rotational component is more significant than the lateral flexion, in which case if I adjust here, left anterior, that might make the difference. Or if I find that it's, let's say, right posterior, I might decide that I'm actually going to adjust occiput or C2 instead. And so, for instance, if you have like a right posterior atlas, that could very easily be a, right anterior occiput. Right. If you're thinking about the relationship, between everything. So what you get to do is kind of play around, figure out like, all right, today we're going to do this and see if it changes. Today we're going to do this and see if it changes. Today we're going to do this. And sometimes it's multiple things, right? I found one little baby that seemed to do a little bit, mild changes when it was atlas, mild changes when it was occiput. But when I adjusted both, I did like left posterior occiput and left anterior atlas. I was basically like correcting this rotation and the child like responded beautifully.
Okay.
I mean, that's the fun part. Like, that's the difference between being a technician versus being a doctor, is like this like exploration of something's not right. I'm missing something. What is it? Let me add another technique. Let me do this. Let me do that.
Cool. At what age does the posterior arch of the atlas ossify?
Oh gosh, I don't remember.
Because he's 8 and it's not
who just took boards?
I don't either, but I had him. I took x-rays with this child because
most of the time, remember, most of the time, if you're feeling that, you're really not feeling the posterior arch. You're feeling more of like the posterior portion of the transverse process.
No, the reason why I'm asking that is because I took x-rays because I wasn't satisfied with the results that I was getting. So his posterior arch is not ossified. And I was wondering if that's normal. And I haven't really looked into any resources yet to decide whether that's normal or not for his age.
Yeah.
I was just asking if you happen to know that.
You know, I don't know. I don't take a ton of x-rays on young children. But the x-rays that I do take are usually more because I sense like a pathology. Like I had this little 2-year-old or this 4-year-old girl that was getting, you know, basically rotary cervical breaks from his previous chiropractor. And the mom said she absolutely hates chiropractic. She hates getting adjusted. And I said, well, that tells me that there's something wrong. And I palpated this little girl and I said, there is something really wrong here. And it turned out she had a Klippel that had from C2 to T2 completely fused, including the rib, the clavicle, and the shoulder blade. And I'm just looking at like, no, you know, no wonder this kid hates chiropractic. I'd hate chiropractic too. Jeez. And so, you know, we started adjusting her with like an activator at like C1 and, you know, occiput, and she started responding really well and she started loving chiropractic. But you know, sometimes it's just about like something doesn't feel right. Let me explore differently.
Well, this kid also, just to add, he is not meeting his milestones either. He's not meeting the growth pattern for his age, and his bones are apparently at 6-year-old as opposed to an 8-year-old. Yeah. So I'm not really sure how much of my input is going to change a lot of things and at what time, because we're seeing a lot of changes, but not with the symptomology that they were originally brought in with. Yeah. So I'm like, do we involve somebody else with care? Do we just keep on this frequency?
The question for me is, are you seeing positive changes?
Absolutely.
And are you seeing stabilization of the subluxation? If the subluxation is still present, that tells me that they haven't reached their healing potential. There's still time. Yeah, and honestly, guess what? Asthma is probably more important to that child's well-being and long-term function than bedwetting. And so the body is going to allocate its resources towards that. You know, I've had situations where I start adjusting this, you know, an older person, and her back pain didn't go away, but her diabetes did. And she says, I don't understand. I came from my back pain. I said, well, your pancreatic function is probably more important than your, you know, damn back pain.
Absolutely.
So
it's just, again, it's mostly me who's not satisfied, but the parents see the benefit. They see everything. It's just where am I? Be patient.
You're not a miracle worker.
Yeah, thanks.
Be patient. Remember, take no credit, take no blame. Your job is to reduce subluxation and allow the child's healing potential to be fully expressed. If you're doing that, if you're seeing changes in the objective indicators of subluxation, you're doing your job. It is not your job to heal this child. It is your job to give this child an opportunity to heal. And on that, I'm dropping the mic and I'm saying thank you so much for joining me. I honestly, genuinely, authentically love and appreciate the fact that you're here listening to me, because honestly, I'm still kind of shocked that anybody does. But have a fantastic night, and then you know, send me some topics to talk on in the future, okay?